We'll have the discussion later. Now I have great pleasure in inviting Dr. Dilip Sarkar. He is from United States and he has come this morning only. He is a general and vascular surgeon of integrated medicine at the in United States, and he has a lot of interest in integrated medicine. He is going to tell us how he uses integrated medicine in vascular surgery. Dr. Sarkar, please.
So dear sisters and brothers of yoga, it's almost 125 years that Swami Vivekananda brought yoga to United States. Today, yoga is a household name in the United States. In the remotest corner of America, you'll find a yoga studio. The therapeutic potential of yoga is known to almost every medical centers in the United States. Every medical school today has a department of integrative medicine who is using yoga therapy as their tool. The physicians now, especially the Western trained one, learn anatomy dissecting a dead body, learn physiology looking at a living human being. Now they realize this body has a mind, this body has a wisdom, this body has a bliss. They started understanding the 5 koshas. They're understanding the 3 bodies, almost ready to understand the concept of chakras. I have been teaching yoga therapy to the physicians for the last 6 years. I have trained over 150 physicians, and all of them are using yoga therapy in their practice. Just this month, June 8th, our Prime Minister Modi gave an excellent talk to the US Congress. He said, there is more Americans are bending for yoga than throwing a curveball. Finally, he said, and no, Mr. Speaker, we have not yet claimed the intellectual property right on yoga. Today, 36.7 million people practicing yoga in USA. 80 million people wants to practice. 72% are women, 28% are men. $16.8 billion being spent for yoga. American believes yoga relieves stress, is good for you, increases flexibility, strength, and performance. Here is Prime Minister of Canada doing Mayurasana on his desk. And he is an avid yoga practitioner. His wife is a yoga teacher. Michelle Obama does yoga. President Obama does yoga. They open the White House on the day of Easter egg hunt. They lay the mats on the White House and they do the yoga in the White House mat. So how the Western physicians are integrating yoga in the healthcare delivery system and how they are going beyond the body, what we're talking about. Western medicine is evidence-based medicine. Yoga therapy is a practice-based evidence. I've been practicing for 5,000 years and I understand the therapeutic benefits. Academic Consortium for Integrative Medicine and Health defined integrative medicine, a relationship between a practitioner and a patient, focuses on the whole person, looking beyond the body and mind to achieve optimal health and healing. Integrative medicine today is almost in 100 medical schools in the United States. 15 years back, only 3 out of 125 medical schools had it. 65 programs have a clinical clerkship. 25 training program has a 1,000 hour of integrative medicine fellowship, which qualified them to sit for the American Board of Integrative Medicine, which just started in year 2014. They understand the mechanism of action of yoga therapy. It is beyond your functional brain. It is in the limbic system. It is in the amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory. It sends a signal through neurotransmitters to hypothalamus, supraoptic and paraventricular nucleus. Hypothalamus sends a signal to the pituitary gland and to the autonomic nervous system. It reduces your sympathetic tone, increases parasympathetic tone, causes quick shift from sympathetic to parasympathetic tone. Through your pituitary adrenal axis, it corrects all the altered hormonal homeostasis. And today, in the cyber language, we teach them the existence of us is in the body, mind, and spirit. Body is like a hardware, mind is like a software, spirit is a programmer. And you heard Alex Hankey, somebody said, where is the subtle body? It is your software. Whatever you do to this hardware is not going to work. You can do all the angioplasties, all the bypasses, all the pharmaceuticals. In United States today, people were taking 10 pills per person, $350 billion pharmaceutical market, and they are called pharmacomafias. So what happens when you start looking beyond the body? The physicians today in integrative medicine realizes there is no problem in the world which does not have a solution, and there is no disease in the world which does not have a cure. Just awaken the doctor within. By practicing a yoga, a relaxation response, activating limbic system, you start looking inside yourself. We must make our body work for us. Nothing has the greatest power to heal but self. Ultimately, what it comes to the point, I am the cause and I am the cure. Unless they figure it out, the yoga therapy is not going to be functional. Hippocrates said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. Yoga therapy is not interested about the disease a person has, rather interested about the person who has a disease. I have an orthopedic surgeon who even understands yoga, has a carpal tunnel, working on this wrist, nothing happening. Comes to me, I said, you do Paschim Namaskar, put your hand in the back, open your chest. It is throughout the totally transforming that person rather than the disease itself. Newer medical schools last year just opened up. It's called Oakland University, Bowman School of Medicine. They put a completely separate department, Bowman School of Yoga Therapy, full-time therapists, and they're advertising. The medical students, residents are rotating in the services. There is a Casey Health Institute outside Washington, D.C. They have a full-time yoga therapist. NIH, National Institute of Health, whole section, NCCIH. Oh, please.
My apologies to all of you and also to the chair, and a very urgent announcement. Some of the people had deposited their bags outside at the registration counter. There's heavy rain outside. So people who have deposited the bags, you're requested to please collect your bags. They're actually getting wet. So for that. Thank you.
So the NCCIH has been developed called National Center for Complementary Integrative Health. They have a whole big section of yoga. They have all the diseases. They are funding for yoga research. If you look at a PubMed, which is almost a Bible for the Western trained physicians, if you just put a search engine yoga therapy, you'll get about 3,500 articles. For your funding, NIH is funding today 380 studies related to yoga therapy. This is the International Association of Yoga Therapists. I'm its president for the last 4 years. We've been teaching the public. We do 2 conferences a year, One is called a Symposium on Yoga Therapy and Research, which is for the practitioner conference. One is called Symposium on Yoga Research, only dedicated research conference in the whole world. We have the books. A friend of mine wrote this book, Yoga as a Medicine. Just published a book, Yoga Therapy and Integrative Medicine. Both Dr. Dean Ornish, probably you know, Dean Ornish and myself, we wrote the praise for the book. We just published this book, The Principle and Practice of Yoga in Healthcare for the Physicians. My book is just coming up, called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. I put the subtitle was Science Beyond Science, and my publisher didn't like it. But I think the Healthy Convergence was a better subtitle. University of Virginia just got a $12 million and for the yoga therapy research. They don't know what to do. They put a contemplative science center. So I went there as their consultants. I trained them. We put a foundation in medical yoga, in health professional, 3 hours postgraduate course, and now they have hired a full-time family practitioner. There is a yoga therapy clinic, and she is getting referral from every department of the hospital. We have a Master of Science in Yoga Therapy called Maryland University of Integrative Health. Dean Ornish, Dr. Manchandan knows very well, he is doing for years and years reversal of coronary artery disease by using yoga. Today, a good news for all of you, his program is called a Spectrum Program and reimbursed by the most powerful insurance company in America called Medicare. How do they incorporating yoga therapy in the practice? A disease, non-communicable disease, is not going to be expressed unless you have a genetic expression. How does the genetic expression takes place? Epigenetics. So we are all, Ayurveda is epigenetics, yoga therapy is epigenetics. So what happened in a primary prevention? A person who has a high risk, if they are continuing to practice a relaxation response of the yoga therapy, mind-body integration, they get a genetic suppression, prevent the onset of the disease. Cleveland Clinic, one of the most powerful centers in the United States, using it. Look at the article in the front page of Time magazine. It says, how not to end up here. That means not going to the hospital. So they have 10 yoga classes a day. They have a meditation center. And the best thing they have ever done in Cleveland Clinic, they put a person called a chief wellness officer. The illness is totally changing into wellness. Secondary prevention. Person has a genetic predisposition, doing all this epigenetics, lifestyle thing, got the disease. Now we have integrating the Western conventional medicine is coming. You are getting surgery, radiation, chemotherapy, whatnot, everything. Now you continue a yoga therapy. What happens? You get a genetic suppression, prevent progression of the disease or reversal of the disease. But the best part of it is the rehabilitation. We call it better management of the disease, less pharmaceutical support, and better quality of life. Even when the genetics is suppressed long enough, we are seeing the cure of the non-communicable diseases. Just to give you a few minutes, the patient, the cardiologist, that's what I put down. This is for Dr. Manchandan, I put it down. This person comes to me, 73 years young. He has this inoperable coronary artery disease. He had a 6th admission of congestive heart failure in 1 year. Ejection fraction was 10-20%. Come to me. I just put down in a chair, told him to keep his spine straight, eyes closed, do some mudras in the hand, do simple breathing out longer than breathing in. That's it. I said, inhalation is sympathetic, exhalation is parasympathetic. Within a short time, within 3 to 6 months, he comes back to my class again. That's what he's doing. He's doing a Bakasana, he's doing a Ardha Halasana. Then he said, I want to learn headstand. So I explained to his handstand. I said, listen, when you put your head down, what happens, your intracranial pressure goes up, intracarotid pressure goes up, intraocular pressure goes up, but when you keep your head down longer and longer and longer, the hypothalamic homeostatic function come in place. Your intracranial pressure comes down, intraocular pressure comes down. Your body gets into called baroreceptor sensitivity. You don't get a sudden rise in the blood pressure and the heart rate. He learned a headstand in 2 years. Look at the numbers. He's off medication now. Even look at his cholesterol, the profile. Look at the numbers. HDL went from 47 to 64. Total cholesterol to 168 to 142. We are showing now that whole coronary artery disease is a part of metabolic syndrome. It is your truncal obesity, diabetes, hypertension, heart disease, and dyslipidemia. Primary cause of metabolic syndrome today is insomnia and sleep apnea, hyperactivation of the limbic system. The moment we are taming the limbic system, your complete blood chemistry becomes normalizes. This lady had a multiple sclerosis. She came to my class on a wheelchair. Now she's standing up. She put a license plate called I'm transforming. This fellow has a Parkinson's disease. He is so good at it now, he gets into a precaution in a Parkinson's disease. He goes to see his doctor. His doctor says, oh, we are going to see Dilip, keep on doing it. He also learned headstand. He says when he gets into the headstand, all the tremor goes away. But see, when they teach the headstand, they learn on their own. Nobody touches them. They put the head down, they keep it down, they keep it down. All the flushing goes away, all the symptom goes away. Slowly they start breathing properly. Remember one thing, Annamaya kosha, if you do any imbalance in the physical body, it shows up in the Pranamaya kosha. The moment your breathing is effortless, the moment you don't have any pain, any symptoms, you are able to do any asanas in the body. This fellow, total cardiac wreck, 1969, he had a open heart surgery. He doesn't know. I think probably should be some VSD or ASD. He had a hypertensive crisis, had a surgery for the descending thoracic aneurysm, atrial fibrillation, congestive heart failure, pacemaker, you name it. Today, he does all the balancing poses and he does all the mudras. Mudras, remember, hand controls your mind. I do all the hand gestures before I talk. His wife comes and tells me, I don't know what kind of exercise he does, he exercises with his hand. I said, honey, you won't understand what he's doing. Let him do. Look at his blood chemistry again in the bottom. It is unbelievable what it does, the control of the limbic system does to your overall, your body. He's just learning again of the balancing poses. It's a personalized lifestyle changes. It is synergistic and it transformative. What it transforms, this is your Michelangelo's David. After 2 years visit to United States, this happened to Michelangelo's David. All the McDonald's, Kentucky Fried Chicken, and it is not here, it is happening in India now. What yoga therapy does, it transforms this Michelangelo's to original Michelangelo's. This morning, the people ask, at what age you can start doing yoga? A photographer took a camera, took a picture of the babies. Every asanas are done by the babies. Why? Because their body and mind is connected. And look at that. Unbelievable pictures. They do naturally mountain pose, naturally sit down in a Vajrasana and Sukhasana, naturally get into a Bhujangasana, naturally get into a Salavhasana. Naturally, look at that, Adho Mukha Savana, cat pose. Look at Jathar Parivartanasana, Jatham Upavesto Gunasana. And we learn, we want to do it. For the children, it is normal. Yeah, when they're anxious, anxiety, neuropsychiatric disorders, we do the child's pose. Look at what the child pose do. They can sleep like this, Supta Baddha Konasana. People with insomnia, we let them sit down to Supta Baddha Konasana, then we let them do the Brahmari Pranayam. powerful treatment for insomnia, and with the Ujjayi pranayam for sleep apnea. And those two are the treatment for coronary artery disease and metabolic syndrome, which Western trained physician doesn't understand. That's what the integration is. They do the boat pose, and I want to finish with a profound slide which I finish all the time. This is the slide, I got it from Dean Ornish. Dean Ornish was a follower of Swami Satchitanand. I don't know if you know, Dean Ornish is we call it a father of reversal of coronary artery disease in the United States. When he was trained by Swami Satchitanand was invited to University of Virginia to give a talk to 500 physicians about yoga therapy. Who stood up, he wrote down illness, then he wrote down wellness, he circled I, then circled we, then he said, when you replace I with we, illness became wellness. Thank you for giving me the privilege. I just came back from, last day. I'm really emotional, to see what is happening in India today. Reason I left this country almost 45, 50 years back, and you know why. But when I went there, I'm very well trained. I was a cardiovascular surgeon. Myself had an open heart surgery. 15 years, I had a triple vessel coronary bypass. I still have a normal blood pressure, 120 over 80, my blood sugar is 80, my cholesterol is 160. Why? This is the activation of limbic system, global sympathetic overdrive, which I learned, figured it out. I had an area of reversible ischemia after my bypass. My left circumflex was not properly bypassed. That's a problem. Within 4 years, with the relaxation response and the control of the limbic system, my reversible ischemia was completely normalized. I pushed against my doctors. Can you get me off those aspirin, statin, beta blockers, inhibitors? No, this is against religion, we cannot do it. I'm a physician too, let's negotiate. We negotiated. Just for information, 10 years, I have not taken a single pill. 10 years, I do 2 to 3 hours of yoga every morning. I am standing here as a living proof that yoga therapy reverses coronary artery disease. Thank you for your attention.
Thank you. Thank you, Dr. Dilip Sarkar, for your outstanding speech. I think he needs a standing ovation. Let's give him a big ovation. I think he has told us how much United States is ahead of us. 120 medical colleges who have integrated. I am told All India Institute is going to have the first one tomorrow. We, I think, should really follow this. They have followed our system and they have found so many benefits. He has shown so many remarkable recovery cases, patients of heart failure, patients of, I've never seen such patients recovering of Parkinsonism and so on. And his own example that he has stopped his medicines. We are scared to stop this medicine, what he is talking about. But I think a remarkable presentation, and he is a true yogi even when he stays in the United States, and we should all follow what he has said. Thank you very much. And I think, do we have 5 minutes for some questions or comments? Yes, just 3 questions we'll say. Yeah. Can you give the mic, please? Organizers, can you give the mic that side? Yes, you can speak loudly. I'll repeat the question. Yeah, be short because we are really short of time.
Sir, Vedanta is using different yoga exercises and asanas, etc., for curing of different diseases. Can you publish, because we can get benefited from that? Is it possible?
Dr. Geeta Krishnan, will you answer?